father of 5, live in New Boston, have for over a quarter of a century. Children ages 27, 20, and twins that are 7 years old. And the explanation, if there needs to be one for that, is that 10 years ago, on November 7th, we tragically lost our 15-year-old son, who was a sophomore at St. Paul's, and he had a drowning accident. And incredibly, my wife and I both agreed that maybe having more children would be the way to go, and we were able to do that. So that's my family story, and family is first, and we'll discuss that as we go along here today. I've been the town moderator, first elected in 1992, so I ran town meetings and the elections up till 1999 when we went to be an SB2 town, and I've run the deliberative session and the elections since then. I became a member of the New Hampshire Bar in 1978 after graduating from Harvard and the American University Law School and clerking for a judge of the State Supreme Court, and have practiced with Devine Millamette, our own firm, Devine and Nyquist, for close to 26 years, and then moved on to the Shaheen and Gordon Law Firm when they opened a Manchester office a few years ago. So that's what I do professionally. I've been a member of an inordinate number of public, what do you call them, nonprofits, elder of my community church, director of the Gunstock Ski Club, where my kids have been ski racers. It goes on and on and on. I was a director of Daniel Webster Council, Boy Scouts of America. So that's what I've been interested in. I've been a Rotarian in Manchester. It's the oldest club in New Hampshire, going back to 1918, and I get close to 20% of that now. I think I joined 21 years ago. Yeah, so I'm over 20% of that long existence. That's the kind of stuff that I like to do. I choose to do it, and it makes my life better, and I think I can make contributions as well. So I've been blessed with, I think, a successful professional career, but more importantly, very successful personal life. Been married to Leslie Nixon for 31 years. Dave Nixon, who many of you probably know, is my father-in-law, and living in New Hampshire, and just I had a chance to meet some of the really fine people of New Hampshire over the years, as they say. I've known them all, and many on a first-name basis, and that's formulated who I am. I'm a moderate Democrat. Indeed, I didn't become a Democrat until I voted for John Glenn in the 1984 Democratic primary, and decided at that point, after having voted here in New Hampshire for a number of years, that I was probably more closely aligned with the moderate wing of the Democratic Party than what was already beginning to happen to the Republican Party. So yes, I have been a proud Democrat for 30 years, but I haven't always been that. And I think there's a lot of people like me in New Hampshire who come from that tradition. I consider it the good government tradition of New Hampshire, and it's really had its weight in spades here in Cheshire County. We know that many people that we all know who represent that, whether they've been Republicans or Democrats. 2 years ago, and many of you probably remember this, the O'Brien-Sanborn legislature is much its personality as its substance motivated me to run. I was already 59 years old, never done anything like this. As you can tell, I had a few other things that I could do in my life and was doing and still have to do. But I said, you know, I've really got to do this. I think I have a chance to win this seat, to make a difference. I think we proved that we can win this seat. Depends on the day of the week that the election is held. It was that close. I kid people, I got to lose this election twice. It was my first one. But I saw each and every vote counted a week after being told what the result was at a recount. And although a lot of the process improved, and certainly the substance of what was coming out of the legislature improved, I continue to believe that, particularly in the state Senate, we can try to build coalitions as opposed to all the Democrats believing in one thing and voting one way and all the Republicans the other way. This is meant not to be disrespectful, because I do respect that Andy Sanborn comes by all of his beliefs honestly, and honestly says what he believes, so that's not a question. But it's just a very different approach, and I don't think it reflects the values that I've discussed, family values, community values, or as I said, the values of good government in New Hampshire. So I want to be a citizen legislator. No political ambitions, too old for that. I want to be a compromiser. I think that's a good word in government. That's what government is all about. I want to be a legislator in the strictest sense of the word. That means that I want to legislate. I want to listen to my constituents. I want to listen to my colleagues. I want to listen to the members of the House. I want to listen to the public interest folks, and most importantly, the citizens that I run into in the district on a daily basis. I don't go in with too many preconceived notions other than a value system. I've been complimented about being a creative lawyer over the years, and I have thought about that, and I don't think I'm maybe particularly creative. What I'm good at is listening and incorporating that which I hear, and essentially adopting that as my point of view and presenting it well. And believe it or not, you learn a lot about that from your clients when you're in the law, and you learn the same thing from your constituents when you're running for public office. So obviously when you've been around and has been as active as I have over the years, I've left out a lot, but I know you have many substantive questions, and I'd like to listen to them all and do the best I can to let you know where I'm coming from.
The first question that we have for you is about minimum wage, and whether you think it should be increased, and if so, by how much?
I do. I don't have a strict number. First of all, I think everyone in this room knows that New Hampshire does not have a state minimum wage. Pure default to the federal government. I think that that's wrong. And so the first thing we need to do is enact a state minimum wage. That will be a process that I would hope would gain some bipartisan support, and I would like to be there to help that. Minimum wage, both on the federal level and on the state level, in my career, has almost always been a stepped process. What I mean by that is you don't have one minimum wage one day and enact the statute and have the highest minimum wage the next day. You have a one or a two-step process over the course of 2 or 3 years. So I don't have a real number in mind. On the campaign trail in discussing this, I have used the number $9 only to be able to talk about the ramifications financially for the state if that is passed. But if we can move in a collaborative fashion to raise it in the first year by something less, and then raise it again, and with that end goal in mind, I think that we would have achieved a lot. I don't want to be digging in up there and saying it's either going to be X dollars or not. I think we need to do this kind of thing by consensus, because certainly minimum wage is something that needs to be supported by a consensus. It is overwhelmingly supported in the polls of the voters, I can tell you that, but it does have strong ideological opposition, led by Andy Sanborn, who believes that there should not be a minimum wage at all, as do some of the national interest groups that he is pledged to. So I think that we should definitely step up to the plate, get a minimum wage in New Hampshire, and move it in a modest fashion in an upward direction. This has a very positive implication for our economy. I believe the number shows $63 million will be pumped into the economy. You say, well, isn't that money already there somewhere? The answer really is no. That money is probably being invested, maybe even in stocks, inactive in the banks, not going into the New Hampshire economy. And as we know, for better or worse, every dime of that goes to a minimum wage worker within probably a week of getting the paycheck, if not less, will become a part of the New Hampshire economy, and we desperately would need that kind of infusion. So it's good for the economy, it's good for families, it's good for community values, 80% of the people affected by this are between the ages of 20 and 64. That's our prime workforce age, so it's not just young people or old people bagging down at the grocery store. These are real people. I think at least 60% of them are working mothers. When I say working mothers, that may not be completely accurate. They are women, many of whom are working mothers. 76,000 New Hampshire workers out of a workforce of about 500,000 would be affected by this, and $63 million, I may have said that already, will be incorporated into our economy. You'll get a stable workforce. Employers can easily absorb this. They will get more productive, more capable workers, perhaps more camaraderie in their workplace. And as I said already, you'll have this $63 million infused into the economy that will benefit all of us. So that's my answer.
What about the argument that it would hurt small business owners?
I reject that out of hand. First of all, we've had minimum wage in this country for generations, way back before we were ever born, and small businesses, especially in New Hampshire, have flourished and been the backbone of our economy. I think that, as I said, small businesses will welcome this, as their employees will be better paid, more productive, and they'll have the access to a good workforce. And ultimately, I think their bottom line will increase when you analyze it macroeconomically, which I think I just did without dotting all the I's. But I think that their bottom line will increase with these modest raises, and I don't have any concern about that.
I'll turn to healthcare for a few moments. Now that the Affordable Care Act's main provisions have kicked in, people have had a chance to see how it's working, and where it's working well and where it's not. What do you see in it that you think isn't working well and might need addressing moving forward?
Well, particularly the options in the marketplace, I think, need to be improved. And I think we're going to start seeing that without any further legislation on January 1st and in the months that follow, when we will have 5 significant insurers in the exchange marketplace. So I think that will have a very significant impact on affordability, frankly on access to the kind of coverage that folks want, good competition in the marketplace, and it'll make the providers even more competitive in trying to become part of these various exchanges. So it may even have an impact on the fundamental problem with healthcare, and that's the high cost of healthcare delivery. So I will do everything I can, both from a bully pulpit, from a legislative process, if necessary, to expand as much as possible the opportunities for the customers in the marketplace. You know, the reason why our marketplace was what it was when it came down is directly related to what Bill O'Brien and Andy Sanborn did in the summer of 2012, July in particular, and I think you folks probably remember that well. The state, those in the state, and particularly the insurance department, who wanted to form a state exchange. And Sanborn and O'Brien absolutely refused to allow a state exchange to proceed in the state of New Hampshire. So we were defaulted into the federal system. You might say, well, so what? So what? It meant a lot. Our state insurance department is not only a regulator of insurance, it is a marketer of insurance. It seeks out insurers to come into New Hampshire to provide the kinds of coverages and the kind of competition to benefit the insurance consumers of the state. That is a very large role of our insurance department. And the commissioner, Mr. Savini, and many at that department wanted to be able to do that, to get the state in on the ground floor, to go out and market this new law, which of course was the law of the land, and they couldn't do it. It was illegal for them to be able to do that. So we already started out skating downhill to the bottom of this situation before the 2012 election. And then, fortunately, we were able to change that in the current legislative session. And now we're going to have 5 marketers out there. So the act is working for the consumers on occasion in a flawed way, but it's expanded coverage. It's decreased the impact on all of us in our insurance premiums because we don't have to pick up the costs of the uninsured. And next to tourism, healthcare industry, for better or worse, is the leading industry in the state. What I mean is more millions of dollars go into our economy from healthcare than any other industry. And they no longer have to subsidize the costs of the uninsured, which was very damaging to them. I think several of the hospitals were in very poor financial conditions, and even some of the major hospitals in much worse condition than you might have imagined. And they were all solid when it comes to the New Hampshire protection plan that was passed by the compromise of Republicans and Democrats in June. Business and Industry Association, Hospital Association, the new PAC of the 5 major hospitals in the state, advocates for patients' rights, all of the rehabilitation industry. They're all solid down the line to allow working folk to get the Medicaid coverage and also to encourage an expansion of the marketplace.
So that agreement in the spring to expand offering of low-income insurance through Medicaid, that relies on the federal government's promise of 100% reimbursement. And at the point at which that falls below 100%, that will go back into the hands of the legislature to decide whether to continue moving forward. That's something that is already built into the federal side of things that will drop in 2 or 3 years. At that point, if you are in the legislature, what are your thoughts on what should be done moving forward?
Well, I think the protection plan, again, that the Republican leadership and the Democrats came together to form is good for New Hampshire. And I would be supportive, obviously, as a lawyer, subject to the evidence presented or the evidence that has happened over the years that pass to make sure that this important program for the health industry, for businesses, and for the consumers of healthcare stays in place. We can't have a system where we as premium payers, on the one hand, are subsidizing uncovered health care, and that the hospitals and providers are taking a financial bath at the same time to keep this in place. What we need is the kind of coverage that with the ACA, with the expanded marketplace exchanges, and with the concomitant Medicaid program. This is essential, in my opinion, for the state of New Hampshire. And it's a $2.4 billion infusion over the first 10 years, as I understand the economic prognosticators have stated. And this is money, obviously, it goes directly into the economy. Working people who are subsidized through Medicaid are not receiving one dime in their pocket. The money is being paid to third parties for the treatment of their health maintenance and their health issues. So it's not a boondoggle in any sense for poor people or even working people. It is good for the industry in New Hampshire as well as the consumers.
Lee, in the last year, both Governor Hassan and the Department of Health and Human Services have classified the drug problem in the state as having reached epidemic proportions. And I would argue that our reporter here, Ella, has covered this topic as revealingly and as cogently as any reporter in the state. It's an important topic for us. Where does, to your view, where does the state need to be focusing its resources and its money with regard to drug addiction? It's talking law enforcement, treatment, awareness, those kinds of programs.
The state has a few essential services, in my opinion, that it must provide. And I think it has to provide for the health and safety of its people. And as you're right, I think New Hampshire is either one or second to Vermont, and particularly in our rural areas, of which I know not too far from here, we have a lot of those communities. And we read every day wonderful obituaries, unfortunately, about wonderful people who die at home at the age of 27. So it is critical. And the state has an obligation. We have to provide mental health beds, as I guess for lack of a better way of calling it. We have to make sure that the addicted have alternative programs in the criminal justice program, that the justices and the masters are adequately trained. And we do have drug courts in the state of New Hampshire. We need more. The problem is not bad people. The problem is really a problem for all of us. And we all have responsibility. I have it, you have it, for what is happening. But I think what the state can do is allow it and encourage it to be looked at very carefully, but more importantly, to make sure that there are adequate services for addiction and for oftentimes the mental health issues that unfortunately underlie the addiction. I think it's been shown, unfortunately, that a much larger portion of those who are addicted on oxycodone or heroin do have some underlying mental health issues. Not all of them, but more so than the average folk in society. And our state needs to step up in those issues. We do have a limited budget. That's not going to really change, so it's going to be prioritizing that is important. I want to digress for a minute, if you'll give me the chance. Rather than talk about this necessarily as a political issue, and I'm not saying it's not, it is, everything's a political issue. But I think it would be good if all of us, whether we're elected or not, can just sit back for a moment, take a nice deep breath, and say, we're going to find out everything we possibly can about why this is happening, how this is happening, who it's happening to, and what are the most effective things that we can do. And I don't think we've got to that point yet. I want to be a part of getting to that point. 30 years ago, we had a very big change, as I understand it, among medical providers, where it went from treating pain in as little as possible to treating it as essentially an equal malady with any and all other maladies, including broken bones, and heart disease, and so forth and so on. So it strikes me, because of all of the opiates that have gone into the pockets of folks, that we swung the pendulum far, far too far. So the medical industry and the pharmaceutical industry has to be a major part of this. I don't blame any of them. Pharmaceutical companies are designed to create medications that the medical industry thinks are appropriate, and the medical industry then prescribes them. But I think, looking at it, subject to being proved wrong, I think we've gone way too far in the area of providing easy prescriptions for potentially deadly opiates, and also opiates that move people into heroin, where they can be combined with fentanyl and all kinds of other mixtures in a deadly concoction that the consumer has no idea exists. It's like going out and randomly buying a product and dying from it. Maybe I got a little too deep into it, but I think that's what we need to do.
And where do you stand with regard to legalizing marijuana and medical marijuana?
I'm in favor and would have voted for the medical marijuana statute that we have. As you know, it's going through a very stringent regulatory process now that is supposed to be completed so that it'll be available on July 1st. So I'm unequivocally in support of that, particularly on the campaign trail, particularly going door to door. You run into, on several occasions, folks who ask that question and have had personal experience in wanting it and not being able to get it, or frankly utilizing it illicitly and benefiting from it. I don't think we're at the point of legalizing marijuana at this point. I know that the governor has stated that she would veto it if it were passed by the legislature. So my strong inclination to answer that question as I sit here today is to say that I'm opposed to legalize marijuana, but I am not opposed to it on any moral basis or anything else. And if it can be shown to me why legalizing marijuana would benefit the addiction problem, I could be persuaded.
You mentioned you were a moderate Democrat, conservative Democrat.
I didn't say, I said I was a moderate Democrat.
A moderate.
I'm not a
All right.
conservative. I'm not a
All
conservative
right. Well,
Democrat.
we'll leave it moderate. One way in which maybe that shows up is your stance on broad-based taxes, which you have said you oppose.
Yes.
Although you would not go as far as a constitutional amendment. That
Correct.
came up last time.
I think the federal constitution and the state constitution, perhaps it's my legal background, and I hopefully understand this, there's a place for broad conception and broad legalities and things like controlling what one tax is going to be doesn't belong in the Constitution. But that doesn't lessen my belief that sales and income tax is not appropriate for our state.
So what that leaves us with is a preponderance of relying on local property taxes for services that everyday people receive: education, roads, plowing, etc. And studies have said that's essentially a regressive tax. What do you think is the fairest way to generate revenues for local and state government?
Well, I'm definitely within our revenue structure going to make it a point to try to get as much money to the localities from state revenue as I possibly can. I do believe that downshifting is essentially the ultimate result of Sanborn and O'Brien's belief system, and not allowing any revenue whatsoever at the state level, especially for essential things such as infrastructure. We have obviously a corporate and business-oriented tax structure in New Hampshire after tourism. And what we need to do is work as hard as we possibly can in a creative way to raise the basis for that tax. In other words, to partner government with the private sector, with the education sector, particularly the post-secondary education sector, and with the labor sector, to create an economy, both on a middle and long-term basis, that is a good one and a sustainable one, and one which will generate within our tax structure the kind of funds that we need when we need to prioritize things such as public education, such as infrastructure, plus the treatment of the ill and infirm. So that's the way that I look at that. And I think it's workable. I think we all have to work hard. The one thing we sure as heck can't do is say that government is the enemy, that private business should not be in partnership with government. It's a symbiotic relationship, always has been in New Hampshire. Private business generates the job, the private business generates the profit, the private business generates the enterprise and business profit taxes. But government helps along the way with a constructive partnership. Things like making sure we have a competency-based and project-based education opportunity for kids as early as freshmen in high school, like we're blessed to have at the Manchester Institute of Technology over in Manchester for several of the towns in Greater Manchester. So I think that's how we have to approach this. It's not a short-term fix, it's not a panacea, and there's going to have to continue to be the kind of belt tightening that we see, but we can't reject all revenue increases for important government services.